Good evening. This is Superintendent Joe Core. We're very fortunate this meeting to have a presentation that will be informative to our community in terms of strategies, but also informative to our community in terms of our district resources with regard to mental health, and specifically the topic of suicide prevention. We are also very fortunate to have with us this evening Sandra Goldmere. Sandra is Area Director of the American Foundation for Suicide Prevention. She is here with us tonight to talk to us and provide us with a lot of information about the topic. In addition to that, you can see that we have our school mental health counselors and social workers here to provide you with face-to-face view of human resources and other district resources available to help us address the important topic of mental health, suicide, and keeping our children safe. So without further ado, I'd like to direct the program to Mr. Casey Barden. Mr. Barden is our Director of Pupil Services for the North County Central School District. Mr. Barden.
Thank you, Mr. Core. I just want to add a couple more items to our what we're going to be discussing tonight. And I'd also like to remind everyone that along with the link that got sent out to the community, we also attached a Google form for the community to submit questions. So at any time throughout the presentation, if you would like to submit questions, our team will be monitoring those questions, and we will provide time at the end of our program and our presentation for the answering of those questions. And we will certainly get to as many of those as we can. We will also open it up to our PAC committee at that time, and we will be offering an opportunity for folks to answer questions. So that's one important piece. I want to add, on top of what Mr. Core already mentioned, I want to add that we all know, we've talked about this throughout the year, that we've really had 15 months of disconnection. And that has been challenging in various ways for students, our staff, our community members. And what we want to really highlight tonight is that there are a lot of resources out there for our families. Albany County, we're very lucky. We have a lot of resources that are available to us, and I know Andrew will be speaking about many of those this evening. But I think it's also important to note that we have a lot of resources within our district and throughout our district. And I want to take a moment just to introduce the rest of our team, a portion of our mental health team that is with us tonight. But we also have school counselors in all of our buildings. We have school psychologists. And I want to, again, like I said, just take a moment to introduce our social workers, student assistance counselors that are here with us tonight, that will really be those point people for us to connect with as community members, so that we can help support you along the way in challenging times, and support you and direct you in the right direction, so that we can, again, have the ultimate goal of supporting our students, our families, our staff members, and our community the best we can. And these are a lot of the faces on this call that can help do that and help support us and point us in the right direction. So I'd like to introduce Sarah Thiel. She's one of our social workers who works with both Southgate and Blue Creek. I'd also like to introduce Carla Natal, who works with Forts Ferry and Latham Ridge. Marvin Horn, who works in our Bout Hills building along with Loudonville. And then moving up to the junior high, the middle school, Stacy Angel is one of our student assistance counselors who is working with our middle school and our junior high currently. And then Stacy Walker and Steve Halleck, who both work at our senior high, our 9 through 12 program. So these are a lot of the faces and a lot of the folks that you will see throughout this program. And also we'll talk a little bit later in answering some of those more specific questions. So at this point, I will now turn it over to Sandra to begin her presentation. Thank you.
on one second. Of course, after I planned it perfectly and started it, it doesn't want to be what I want it to be. Perfect. All right, sorry. All right, so again, thank you so much to the North Colony Central School District for having me here today. Again, my name is Sandra Goldmere. I'm the area director for the American Foundation for Suicide Prevention here in the Capital Region, actually covering 15 counties from Columbia Green all the way to the Canadian border, and also the proud parent of 3 Shaker students, two grad and one still in the system. So suicide really is a sensitive topic to discuss, but I'm so glad that North Colony has taken mental health and suicide prevention seriously and sees it as a topic that we need to bring out of the shadows and out of the darkness. And really talking about suicide is critical to its prevention. And I'm so grateful to all of the people who've joined online and on YouTube to have this important conversation. And so overall, I hope today that you're able to learn more about suicide prevention from today's presentation and be more comfortable talking about this important issue. So suicide is a complex health issue, but despite its complexity, it can be prevented. And so just like there are warning signs and risk factors for other health crises like cardiac arrest, we can learn the warning signs and risk factors to help us prevent people from dying by suicide. And just like other health issues, prevention can start early, far in advance of the problem, or occur closer to the time of a crisis. And time can be a critical and life-saving measure. Typically, what we're going to learn today is that a life can be saved if we allow time for the person's suicide risk to subside and get through a period of distress and get to mental health help. So to prevent suicide, we need to identify people who may be suicidal, as well as take an active role in connecting them to help before they act on their desire to end their lives. The purpose of this presentation is to really provide community members such as yourself with a general overview about suicide, who it affects, and how we can all work to prevent it. It's also going to provide some statistics to give us an idea of the scope of the problem. And we're going to look at key research, including risk and protective factors that relate to the issue. And lastly, we'll talk about what works and what we can all do to prevent this leading cause of death. But before we get started, I want to go over terminology that's used when we talk about suicide. It's really important to model appropriate language so we don't perpetuate the stigma of suicide or other mental health conditions. So let's establish a baseline of shared language on the topic. At AFSP, we avoid using the phrase committed suicide, because if we want to treat it like other health issues, we need to talk about it simply and plainly, just like we do about cancer or diabetes or any other health issue. So we just say things like died by suicide, ended their life, or killed themselves. And the same goes for when we talk about suicide and suicide attempts. We avoid referring to them as failed or successful. Not only is it unnecessary, it implies judgment. So instead, we just encourage the use of a phrase, suicide attempt. Educating the public about suicide is really critical because it encourages help seeking, it raises awareness of risk in vulnerable populations, and advocates for new interventions and prevention strategies for those at risk. When we talk about suicide safely and accurately, we can help reduce the likelihood of its occurrence. We really want to change how society understands mental health and suicide, because when we open up and connect, as the topic of this presentation shows, talk really can save lives. So let's look at the scope of the problem, because it is a significant issue that affects families and schools and individuals and communities. And it's worldwide. Over 800,000 people die by suicide every year. And while this is the most accurate data available, we actually estimate the numbers to be far higher, since suicide is underreported in many countries, including our own. But even with that number, somebody dies by suicide every 40 seconds worldwide. And in the United States, suicide is actually now the 11th leading cause of death because of the COVID pandemic. But generally, for the last 2 decades, it's been the 10th leading cause of death. And here you see on the screen, it says 48,000 people died in 2018. We get our data about 2 years behind. And in January of 2021, we actually saw for the first time in 2 decades, a drop in suicide rates by about 2%. Earlier this year, and actually in April, we got some more data that showed that in the pandemic, we actually have seen further drop in suicide and completed suicide in the United States. And many people have asked, how is that if we've been hearing so much about the increase in people who are struggling with their mental health? Well, both are true. We are talking more about mental health, and that is super important. And being close to each other and more connected in community may have caused our suicide rate to drop a little bit during the pandemic. But we don't know yet, because we don't get our full data, what communities and demographics that has specifically affected. So it's even more important that we continue to talk about suicide like any other cause of death. The more we talk, the less stigmatized the idea that we all face struggles and need support becomes. Suicide takes more lives in the United States than homicide, war, and natural disasters combined. And in addition, suicide is the second leading cause of death for people aged 10 to 34. So it's really important that, especially when it's about our youth, that we talk about this topic openly and honestly. In addition, for every death by suicide, it's estimated that 25 other people attempt. And that's about 1 million Americans each year who survive a suicide attempt. And when you think about any loss, it impacts people in the community, and suicide is no different. It affects families and friends and coworkers and neighbors and schools and faith communities. And it's estimated that a majority of Americans will experience a suicide loss over the course of their life. So let's move on to research. Only in the past several decades have scientists even begun studying suicide. And it's really shedding light on critical areas, what drives up risk, what amounts to effective suicide prevention, and we know we still have so much more to learn. AFSP is one of the top funders of suicide prevention research, and this section provides an overview of key research findings and future goals in the field. So one of the main questions that research explores is, why do people take their own lives? And through research, we've learned there is no single cause for suicide, but rather, it's when several stressors and health issues converge to create an experience of hopelessness and despair. And research has also consistently shown that a majority of people who die by suicide do have a mental health condition contributing to their death. It may or may not have been recognized by the person or their loved one, and may not have been diagnosed or adequately treated. But that said, research has also made it clear that mental health conditions cannot be the whole story. 1 in 4 people in the United States will experience a mental health condition during their lifetime, and most do not go on to die by suicide. So we've also learned from research that there are physical differences, especially in the brains of people who die by suicide. Their brains themselves differ, both in the terms of structure and function, especially in the areas of stress response and impulse control. And we've also learned that most people who are suicidal are ambivalent about taking their life. Part of them wants to live, and part of them wants to end their life. And it's informed key strategies in suicide prevention that involves engaging the part of the person that wants to stay alive and creating distance from the part of them that wants to die. So one way we do that is helping the person connect with reasons for living, and while decreasing the visibility and presence of things around them that might facilitate their desire to die, or what we call creating a safe environment. And one of the many important things we've learned from research is about the perspective of a suicidal person. What we've learned is that a crisis point has been reached. For a suicidal person, pain is the driver, and it seems unbearable. This could be emotional pain, physical pain, or often both. So for a moment, I'd like you to think back to the most physically painful experience of your life. That could be childbirth, kidney stone, broken bone, whatever. At that moment, would you have been able to give someone clear and accurate directions to your home? Probably not. Pain makes ordinary thinking nearly impossible. For a suicidal person, the thinking becomes constricted at the moment of crisis. It's like an intense state of tunnel vision where other options seem unavailable. Someone who considers suicide cannot foresee a time when that unbearable pain will end. But understanding that perspective of a suicidal person has also helped us learn that those feelings are often temporary. They come on intensely and can sometimes pass in minutes or hours. And that's why helping to keep people safe and helping them feel supported can get them through those critical moments. We'll discuss this more later, but there's evidence that putting time and distance between an individual who's in crisis and the means to take their life, what we call lethal means, can be a life-saving action in itself. And that's why it's so important that we take steps when we know someone is struggling to keep them safe. So the next question becomes, who's at risk, or what increases the key factors for suicide? So we have three groups of risk factors or characteristics that increase a chance a person may be in crisis or take their life. It's really important to know to understand the big picture of someone who might be in crisis, because just like someone who's at risk for heart disease because of high blood pressure or a history of heart disease in the family, some people are at higher risk for suicide than others. And they're shown here: health, historical, and environmental factors. These factors can converge at different times in life and increase a person's risk. So let's look a little closer. The first type of risk factor is a health factor, such as biological or psychological medical conditions, the most significant of which are mental health conditions, and the most likely of that is depression, although bipolar disorder is also shown to be high risk. But all of these on the screen, anxiety disorders, eating disorders, substance abuse, PTSD, also can increase suicide risk. And because these conditions put a person at higher risk, detecting the presence of a mental health condition is critically important. And the best way to be sure when you feel concerned or detect a possible change in you or your loved one's mental health is for that person at risk to seek professional evaluation, if possible, and effective treatment. Many people may not realize that their distress actually has become a health problem. And that's why we sometimes only talk about it at the moment of crisis. It's about learning to look at our mental health like our physical health way back at the beginning. Providing information about how to access mental health care or a crisis number if distress is high can be a solid step in beginning to connect someone to the help that they need. And we'll talk more about that when I discuss prevention. But mental health conditions aren't the only health factors that are associated with risk. Serious or chronic health conditions can increase risk as well, especially when the person has mental health issues. And that can include things like serious or chronic health conditions, chronic pain, and traumatic brain injury. The second type of risk factor include historical factors, such as family history of suicide, history of mental health conditions, or past trauma such as sexual abuse or combat stress. In addition, research has shown that a history of childhood abuse also contributes to risk. And while most people who attempt suicide do not go on to die by suicide, as we mentioned before, previous suicide attempts are also considered historical risk factors and put a person at increased risk. The third type of risk factors are environmental factors that involve the circumstances in a person's life. Often there are aspects of a person's environment that contribute to their overall level of risk. So let's look at a few of the most common. First, having access to the way of killing oneself is what we refer to as access to lethal means. That can include a variety of things: firearms, medications, a bridge, a car, etc. Research has also shown that contagion, or the exposure to another person's suicide, or graphic or sensationalized accounts of suicide, especially among those with other risk factors, can also increase a person's risk. And prolonged stress can include harassment or bullying, relationship stress, legal problems, unemployment, or stressful events that vary across the lifespan, including divorce, legal problems, or job loss. Because we're talking as well about students and schools, I wanted to talk a little bit about two other environmental factors. The first is bullying. The relationship between bullying and suicide is complex. When other risk factors are present, being bullied can be a precipitating stressor that can increase risk. And research indicates that persistent bullying can lead to or worsen feelings of isolation, rejection, exclusion, despair, especially as well as to depression and anxiety. But bullying behavior also indicates underlying risk in the bully. Any involvement with bullying behavior, whether as the bully or the victim, is a stressor which may significantly contribute to feelings of helplessness and hopelessness that raise the risk in teens. That being said, suicide is not a natural response or reasonable solution to bullying. Bullying is one factor, but does not directly result in suicide. Suggesting that it is the case could increase contagion risk. It is important to note that a large majority of people who experience bullying do not become suicidal. In addition, I wanted to speak for a moment about social media. The research in this area is emerging, and social media continues to evolve at a rapid rate. Some people use social media with a mixture of positive and negative results. For young people with risk factors, including depression or anxiety, low self-esteem, or extreme interpersonal sensitivity, social media use can have negative effects on their mental health. But it's also important to note that young people may also use social media to reach out for help or to indicate their distress behaviorally or verbally. For example, suddenly disconnecting from social networks via social media, or making statements on social media, indicating a desire to die or escape their pain, or disclosure about gaining access to lethal means. So just like we encourage young people to alert a trusted adult if they notice or hear things being said, they should also be encouraged to notify an adult if they're concerned about a peer's social media posts. Of course, heavy use of more than several hours per day is not recommended. Social media utilization should ideally be limited in quantity and approaches. And of course, during the pandemic, this has been a different community of them needing to connect with others, including with social media. Some people do astutely, however, take long breaks from social media for their mental health because they've learned it's an important part of their overall strategy. And it can be easy for us to mistake mental health symptoms for other typical youth behaviors, such as normal adolescent mood swings, laziness, poor attitude, or immaturity. That being said, those perceptions that adults have may actually inhibit adolescents from seeking help, which is why it's really important to take talk of mental health, mental illness, or suicide seriously. When you notice a change, it never hurts to have a conversation with your child about what you're seeing. And you may want to speak with their doctor about the changes you're seeing as well. Before we move on, I want to have one other topic about understanding suicide risk. The example shows what is often the public perception of suicide. When somebody dies by suicide, often the story only talks about their environmental factor. People see a life event like a breakup or bullying or a job loss, and they see the person die by suicide, and they assume the person killed themselves because of that stressful life event. What we're learning is that's never the full story. Others don't know is that the person who died may have had a genetic risk for suicide. Maybe they were suffering from depression and anxiety, and their work life or school life had become increasingly stressful. Their underlying depression or anxiety could have made the situation at work or school worse, or the school or work stress could have made their depression worse. Perhaps they'd been using substances like alcohol. The key is that it's the combination of risk factors that could have contributed to the suicide death. Therefore, while a life event can play a precipitating role for suicidal behavior, without other underlying risk factors, life events alone are not thought to cause suicide. Looking to the future, research will help us find ways best to fight suicide. Research is looking for biomarkers, for example, something testable in a blood sample that might identify those at increased risk. And we're looking at a number of clinical treatments, particular types of therapy that might be more effective, and more to need to be developed and studied. The good news is that through research, we're learning more and more about what helps those who are in suicidal crisis. And research will help us identify the most effective programs and interventions to reduce suicide rates and to reduce risk in those suffering from mental health conditions. So let's move on to prevention. Just like there were risk factors that increase a person's risk, there are protective factors that lower a person's risk. If you're proactive about mental health and make an effort to get healthier, you protect yourself. More on that in a moment. Feeling connected to family and community support can protect against suicide, and school is part of that. When someone is struggling with depression or anxiety, protective factors that may normally be strong can erode and temporarily weaken. When that happens, having a community to remind us of our strengths can be a tremendous preventative factor. In addition, problem-solving skills help. Life can get really tough, but being able to see a way through problems is also a protective factor. And lastly, culture and religious beliefs that encourage connecting and help seeking, discourage suicidal behavior, or create a strong sense of purpose can also be a protective factor. Because mental health care is so important for preventing suicide, I'm going to focus on that topic for the next few minutes. Getting effective treatment for mental health conditions like depression or anxiety can be a preventative factor. Because critical to suicide prevention is getting people connected to mental health support. It's one of the biggest challenges in fighting suicide because we need to get people to address their mental health in the same way they would for their physical health. In fact, of those suffering from a mental health condition, less than half seek treatment. So one way to encourage a change is to treat our mental health just like any other aspect of our health. There are certain times when a person becomes ill or has a chronic health condition to manage, and it's critical to seek support. We need a culture where everyone knows it's smart to take care of our mental health and to treat it just like our physical health. Seeking a mental health professional needs to be seen as a sign of strength, not a sign of weakness. They should request a thorough evaluation to figure out if there is a mental health condition affecting their life. And also to know that there are many types of treatment available. Some people respond to psychotherapy, some medication, and sometimes both together works best. It's about finding what works best for an individual. And so I wanted to take a moment to talk about the fact that sometimes symptoms aren't recognized as signs of a possible health condition and are dismissed, even by the person experiencing them. Fear of what treatment might involve can also keep those who are struggling from reaching out for help. And if there's an overall sense of despair or hopelessness, both symptoms of depression can lead someone not to reach out for help. They may not, especially with teens, they may not believe that there is help or that they can be helped. And when help seeking is not seen as a sign of strength, those who are struggling often don't reach out for help. That's why North Colony is working so hard to create a culture within their schools and in their society that makes reaching out for help socially acceptable and truly a sign of strength. When help seeking is seen as a weakness or mental health conditions are misunderstood or mocked or demonized in the media, people are too embarrassed to reach out for help. With our teens, sometimes they believe that the adults won't understand, so they don't reach out. And lastly, often they don't have the means or access to resources to seek help for themselves or know where to go. They may not be able to afford treatment without their parents' contribution or not have means of access to transportation to get there. So those are things to consider about barriers that might exist. One thing that is good to know is that advocacy efforts are improving access to mental health services so that more people can get treatment that they need. The law does require insurance plans to cover mental health services on par with physical health services. So if we need those services, and 1 out of 4 of us will at some point, we should work to find a place to go and to get our health back on track faster. So I want to talk a moment as well about mental health self-care. Just like people can find strategies to optimize their physical health, people can do the same for their mental health. It's not a substitute for professional care, But there are plenty of activities that one can do to reduce stress, encourage wellness, and restore a sense of well-being during difficult times. It nourishes our body and mind and spirit. Self-care is the very thing that allows us to do everything we want to do in and with our lives. It's what gives us energy and strength and resilience to keep going. So let's take some time to review different self-care activities that you could try the next time you need to take a step back, breathe, and focus. The way one thinks or the things that fill our mind greatly influence our psychological well-being. So it's about doing self-nurturing things like reading a good book or talking kindly to ourselves. These are just examples, and you know yourself best. Do what works for you and don't be afraid to try something new. In addition, when we think about self-care, we often think about massages and pedicures. However, some of the most important self-care activities are those that tend to the more mundane needs of the body. We need to broaden our definition of self-care and think of it not as an indulgence, but sort of a necessary form of scheduled maintenance. These kind of self-care activities help us combat fatigue and stress and anxiety. And it's so important in improving our well-beings and quality of life that nurturing our spirit is important too. It can involve anything that helps us develop a deeper sense of meaning or understanding or connection with the universe. So you could set aside time to volunteer or talk with someone you care about. Self-care is truly important. And lastly, it's really vital for building resilience towards stressors in life that we can't eliminate. It's not a luxury, it's a priority. It doesn't take a substantial amount of time or money or planning. So just take time to change your scenery, go for a quick walk around the block, pause to savor a sunset, or meet a friend. Before we move on from prevention, I want to talk a little bit about people who are at a crisis point. I talked before about time and distance. The most important thing you can put between a suicidal person and their way of ending their life is time. Research shows that by temporarily reducing a suicidal person's access to lethal means, we give them time for that intense risk to diminish, and time for someone to intervene with support and resources. And for a majority of the people who experience a crisis, if unable to access their chosen method, even temporarily, they are unlikely to engage in another action to end their lives. Let me say that one more time. If somebody has chosen a method to end their life, and if they're unable to access that method, even temporarily, they're unlikely to engage in another action to end their lives. So therefore, a clear way to prevent suicide is to limit access to lethal means. So what would that look like? Because during a period of higher risk, the safer an environment is, the better chance a person has of living through the crisis period. It could be as simple as installing an inexpensive carbon monoxide sensor that would automatically shut a car off if the levels reach unsafe levels. We've also learned that installing bridge barriers deters suicides, and in many cases, those barriers actually lowered a suicide rate for an entire region. Restricting access to potentially lethal medication includes things like requiring lethal drugs to be sold in blister packaging. And lastly, firearm safety is critical because in the United States, firearms are used in roughly half of all suicides, making suicide prevention an important part of gun safety education. It might be not something you didn't know before, but as I had said, when access to lethal means are limited, most people who are suicidal do not find other means. Therefore, the suicide death does not occur in that moment, allowing more time for the person in crisis to get connected to help. So now let's talk about what we can all do to prevent suicide. It's really important to have a caring, supportive conversation with someone you might be worried about, to allow them to share what they're experiencing. That conversation is a way to show you care and allows you to gain more information about their level of distress. We're going to start by talking about warning signs to watch for yourself and others, because while many of the risk factors we talked about in the beginning endure over a long period of time, Warning signs are observable signs that a risk might be in the near future. And it's really important to pay attention to both. If you see warning signs, reach out to the individuals in your life you're concerned about. And if it's yourself, reach out to others. We should seek mental health services if our anxiety or depression is interfering in our daily life, and encourage others to do the same. So let's talk a little bit about suicide warning signs. And they fall in 3 buckets: talk, behavior, and mood. First, many people who are suicidal talk about ending their lives. It may be directly or indirectly. They may say it outright, or they might joke about it. We need to take it seriously every single time. Some people may say they have no reason to live. Others may feel trapped or tell you that they're a burden to others, or they might talk about feeling overwhelmed or being in unbearable pain. There are behaviors that are atypical too, that should encourage you to speak to the person about what you're noticing, because people in crisis can display certain behaviors. There might be an increased use of drugs or alcohol, or issues with sleep, whether sleeping too much or having insomnia. They might start acting recklessly or start withdrawing from activities they normally enjoy. In addition, they might isolate themselves from family or friends, or you might see that they are looking for a lethal means method, whether it be searching online or shopping for a firearm. And lastly, they might give away their possessions or show a related behavior of reckless spending. And people at risk for suicide can display, often quite subtly, any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, anxiety. These are all moods one would expect of someone who feels overwhelmed and desperate. Now, we all have ups and downs in our mood, but it's about noticing a change that seems uncharacteristic or concerning or lasting longer than normal. And when you do, it's important to speak to the person about what you're noticing. For example, somebody who's normally depressed who has sudden unexplained happiness could also be a concern, because it might mean that the individual has decided on a plan and is relieved they will no longer be in pain. So here's a few things to remember when talking to your child. Take it seriously and don't wait to act. Be calm, which I know is hard, and be prepared to listen. And be willing to ask the direct question. Have you ever felt so bad that you've had thoughts of suicide? Research has shown that it will not put the thought in his or her head if they aren't already thinking about it. You may also want to identify a helping professional prior to having the talk. But what is most important is that you reassure them that you're going to get them help. You may want to talk to others who interact with them, like teachers or coaches, to see if they've noticed any changes. And remember, a stressor that may seem small to us is not small to them. And it's really important to validate how our children are feeling about their current situation, even if we may see the situation very differently. This has come up a lot with the pandemic, is that what we might not see as a loss, giving up a prom or an event in the long course of their life, but it's grief and it's something they're dealing with, and we need to be able to validate. There's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. I want to show you a quick video. So as she said, I want people to just remember that there is a lot to look for changes in behavior, and we need to trust our instincts and assume that you're the only one who's going to reach out. In many instances, people talk about their concern for someone amongst themselves, but hesitate to reach out to the person directly. Here's a rule of thumb. If you're concerned about someone, reach out. And the same goes for you. If you're having thoughts that are uncomfortable or you feel like they're suicidal, that's just a sign you should reach out. And if you've reached out before, reach out again. The first time a person might not be receptive, so keep trying. Or try talking to someone else or with a professional. And what we've learned is that even if suicide turns out not to be a concern, the person may still be in distress, and what they want is to feel seen and heard and supported. And so they may feel comforted just by knowing you care and are taking the time to listen. By talking directly and compassionately with your child about their concerns sends the message that you notice, you care, and you're going to help them. And in addition to helping your child, you can also be aware of risk you may notice in their friends. And when asking about their friends, you might want to start by asking if they've had friends they've been worried about. Or maybe you could comment on specific behaviors, like, I noticed the last time John was over, he seemed kind of down. How do you think he's been feeling? Or later, do you think John might be feeling suicidal? And if you get a report that a friend is feeling suicidal, contact the school or the parents, but contact someone and love them. You know, as we said before, trust your gut and don't be afraid to ask directly. Just one other thing is that there are special considerations to take into account if your loved one is a minor. And we're going to watch another video next that talks about how we support a minor engaging in treatment. There's some other things to avoid too when talking with someone who may be suffering from anxiety or depression. Avoid minimizing their feelings. Those of us who have never experienced major depression literally cannot imagine what it feels like. In addition, avoid trying to convince them life is worth living. We talked a little bit before about the viewpoint and the crisis point that somebody's been with, and that they're not thinking clearly. So a philosophical debate tends not to be helpful. And lastly, avoid giving advice to fix it. If a person were having a heart attack, you wouldn't tell them at that moment to start exercising or to eat a healthier diet. As I said before, if somebody's in crisis, what they need is to be heard and seen and led to help. Listen to their story. Offer to help them find a professional. Take active steps toward keeping their environment safe. And there are some steps you can take if your child reports thoughts of suicide or you suspect that they're feeling suicidal. Even though it's hard to do and you're probably scared yourself, stay calm. Let them know they did the right thing by thanking them for having the courage to tell you, and reassure them that you're going to find a way to help them. Contact a mental health professional for an evaluation as soon as possible. And work to reduce immediate stressors. And I know that the North Colony Mental Health will talk a little bit about this too. But one thing to think about is that it may include things like taking a sick day or a mental health day from school, missing football practice, etc. A good rule of thumb might be, what exception would you make for your child if they had strep throat or a broken bone? And finally, take a moment to secure lethal items in your home. Make sure that any firearms are secured and stored separate from ammunition or temporarily held by another person until a crisis passes. Lock up prescription medications or other items that your child might have mentioned they were considering using. Make the environment as reasonably safe as you can for as long as necessary. And sometimes a crisis point has been reached, and scheduling an appointment a few days from now is not enough. Take action immediately if you find a note written by your child, if they report hearing voices, if you're afraid to leave them alone, or if you discover they've made a non-lethal attempt. If you just feel in your gut that your child is not safe and you're afraid to leave them alone. And so now is a short video about supporting minors and their treatment.
If your loved one is a minor under the age of 18 years old, you may need to take a more active approach to help them connect to treatment. If this is your child or if this is a loved one who's under the age of 18, they often need an adult to consent for their treatment with a provider. And I think also helping to reassure the young person that this doesn't mean that you need to hear everything that goes on in their therapy, that it's really important that you support their discussions with a therapist, and that the agreement you can have with the therapist is that if they become aware that your minor loved one is struggling in a way that requires more imminent action, that they will notify you. I think what happens is that you need to allow the minor person, your minor loved one, to form a therapeutic relationship where they feel they can share things, and that it's not a direct line to the other adults in their life. That said, you want to make sure you do have an open line of communication with the provider, particularly if there's worsening mental health, if there is a more imminent crisis situation, that the provider knows to get in touch with you or the guardian for the child. The bigger point here is that if your loved one is a minor, you may be taking a more active role in helping get them to treatment. Both logistically in terms of finding a provider, helping figure out appointments and those things, but also in terms of taking them to treatment and consenting for their treatment.
And lastly, if you think anybody in your life may make an attempt soon, it's important to stay with them if possible. Don't leave them alone. And for some of us with social distancing, that may be staying on the phone with them or continuing to text with them. However, if the situation puts your own safety at risk, obviously leave the area immediately and call 911. We talk about creating a safe space, so help them secure or remove lethal means, and if you can, escort them to mental health services or an emergency room. And before we finish, I want to provide some resources. The first one is this slide, and if you're watching either on the Zoom or on the YouTube, take a picture of this screen. This is the Suicide Prevention Lifeline and Crisis Text Line. They're available 24 hours a day, 7 days a week, 365 days a year. And even if you never use these resources for yourself, you could need them to help a friend, and you can always call them for advice. They are trained professionals in helping with prevention. On the screen as well is a variety of Albany County community resources. You'll see on here that we do have an Albany County mobile crisis team that's available not 24 hours a day, but definitely many hours of the day. And CDPC, or our Capital District Psychiatric Center, does have a 24-hour emergency mental health assessment. We also have a child and adolescent mobile crisis team that's available until at least 9:30 at night. And Ellis Hospital does have a teen mental health emergency room and also 24-hour emergency mental health assessment. And obviously, if it's an emergency, such as a suicide attempt in progress, always call 911, or at least for now until 988 is available, and we can talk about that after. Together, we can create a culture that's smart about mental health. Together, we'll save lives and vastly improve the lives of many more. It's a simple yet powerful idea that talk saves lives. By caring and reaching out, we can all play a part in changing our culture about mental health and playing a part in suicide prevention. So I'm going to stop sharing at this point so that the North Colony staff can talk about their what they can offer as well and answer any questions you may have.
Sandra, I'd just like to say thank you very much for a very informative presentation. We really appreciate it. It was full of a lot of good information for our families and for all of us on this call. So thank you very much. And at this point, we are going to transition into our question and answer portion. So we've been monitoring the questions that have come in through our Google form. And what I'd like to do first is start with those questions that have come in. And then also we'll open it up to our PAC members after that to answer any questions that you might have. And I am going to kick it off with starting with Mr. Kaur. I think we've received a couple of really good question about our teachers' mental health, which is very important to us. And I'm going to turn it over to Mr. Kaur to touch on that briefly.
So thank you, Casey. So I think first of all that we have, have to recognize here that this time has been enormously stressful for our teachers in terms of just living with the stresses of COVID-19, the environment that exists in our society right now, and also the attendant pressures, struggles, work, unfamiliarity, moving into new frontier, the sense of lack of community and relationship that they normally had to their environment. So I think we need to recognize that. We need to recognize the stress, the enormous work that our teachers have accomplished during this very difficult time. I think also, having been a teacher for a long time, having come from a family of teachers, I know that teaching is deeply personal work. And so that experience of having that personal work that you are very much tied in your identity with that work is important. And I think so that is an additional wonderful thing, but it's also a stressor and a complicating factor, especially during these times. So having said that, institutionally and structurally, we have something called the Employee Assistance Program here in North Colony, where our faculty and staff can access that program, and they would be put in touch with mental health professionals. They would have access to counseling as part of the district's participation in that plan. So I think, that is the structural plan that we have in effect. I think the other aspects that we have here is that we are limited in our access to one another and to our community, but we do have a strong community where people care for one another, are compassionate towards one another. And I think that community in and of itself is a strength where we really need to be looking out for one another and to be attentive to one another's needs, and to just know when we are struggling, when we see our colleagues struggling, that we are here for them in community. But in terms of professional services within North Colony, the one service that I would point people to would be the Employees Assistance Program. And I would tell our employees that if they are experiencing mental health concerns, issues, that would be an important resource that would be available to them.
Okay, thank you, Mr. Kaur. And I'm going to start with the first question and introduce Sarah Selaton-Thiel, and she is going to start us off with the first question this evening.
Thanks, Casey. I'm going to summarize a couple of questions because we got several questions about lack of services, feeling like there aren't enough counselors in the area, long waits for counseling. And yes, all of that is absolutely true. And I think a couple of people even said, hey, can you recommend somebody, just in the questionnaire? So I don't want to, in any way malign our partners in the community. This is a very busy time of year historically for the children's mental health system, really the entire mental health system. We come from a long winter, and people start realizing, oh, I'm not feeling so good. And they think about getting and having the energy to go to counseling. So yes, this is historically a tough time of year. And this is made more difficult, obviously, by the pandemic that we've all lived through these last 15 months. What I think our message is as a team is we would like you to be in touch with us. And at the end of all this, we will put up a slide that has all of our contact information in the schools we cover. We think that one of the most important things we can do is provide a very personal experience so you can feel like you can reach out to one of us, depending on our school or who you're comfortable with, and really have a conversation with us and talk with us about what it is your child or your family may need. And we will work with you to find somebody who we think we know in the community who has some expertise in the issue that your child or your family is experiencing, that fits your insurance so it's affordable for you, and may fit some other criteria. We sometimes have families who request a man or a woman or somebody who has an expertise in a certain area. So our best advice is, yes, we understand that we recognize that this is difficult right now, extra difficult than it typically is, but please be in touch with one of us and we will provide you with the most personal service we can to find you what you need. And sometimes the match between therapist and kid or family is just not a good one. And that we understand that too. So don't ever hesitate to be in touch and say, you know what, this person you sent us to isn't working for us. Well, is there somebody else? That's our job, is to help figure out who's in the community to help and also to help advocate. We may know somebody that you may not be aware of, or we may know of a new practice that's started.
Thank you, Sarah. I'm going to turn it over to Stephen Halleck, who is one of our student assistance counselors at the high school.
Thanks, Casey. There was a question from the community about someone brought up that their son's friends often bring up mental health concerns to their son, and they talk a lot about things that are serious and a lot of the topics that Sandra discussed tonight. And the advice I would have to that parent is, and I think we all would, is to keep that dialogue open and to validate what your child is thinking and feeling, and to also ask your son to point those friends to trusted adults as well. And trusted adult doesn't have to be a social worker or a student assistance counselor. It can be a coach or a teacher or an uncle or any adult that is trustworthy and take steps to get them the help that they need. So keep that dialogue open is the biggest thing, but also encourage them to be seeking out support from adults. And I also just wanted to touch on, it relates, something that Sandra brought up in the presentation is stigma and culture. And in North Colony, in our schools, we work a lot with students on culture of seeking mental health support. And we visit health classes in all of our buildings. We're in classes talking with kids in large groups and about the supports available to them and trying to chip away at that stigma. And I think I can't speak for everyone, but I'm generally perpetually uplifted by the culture that our young people have around mental health these days. And I think that things are changing for the better overall. So again, keep the dialogue open, keep talking about these things.
I just wanted to mention one more thing. As Mr. Halleck mentioned, I'm Stacy from the high school as well, Walker. When we do go into health classes, especially for the high school age, where they can be a little sensitive, if they're concerned about a friend, but they don't want to look like they told on a friend or they like hurt a confidence, we often tell students that we are very much able to, and we work with them to be confidential. So a lot of kids sometimes, or even parents, will call and say, I'm concerned about, I saw something on social media. I'm concerned about a child because of what I saw. Or a kid might say, I saw this, I don't even really know the person. And we often will reach out confidentially to them just to say, hey, there was somebody that saw this and they were really concerned. So we're reaching out now to see if maybe you just need a little more support, if you need somebody to listen to you. And I think it helps, at least at the high school level, those kids to feel like, okay, maybe then I'm more likely to come and tell an adult if I don't feel like, that person's maybe going to be as upset with me. And, most of the time when that happens, often kids will come back later and honestly say thank you, because my friend happened to mention they don't know who said something, but they didn't realize everybody was really listening, and it meant a lot to them that somebody cared enough to go and talk to somebody. So I think that's key too for parents to know, if your child or you have heard from your child and you're worried about hurting that relationship, which has come up, we're very good about finding ways to address it and check in on a student without necessarily having to name names, but just more to come from a place of, hey, we care and we just want to check in. Just wanted to throw that in there.
I think too, it's really important that we, most of us grew up, especially as adults, in a culture where we were not great stewards of talking about our mental health. And I think the more that we can be really good role models, especially in times of stress right now, is talking with our youth and talking, honestly about things that cause us stress, but also what we do to manage it, what kind of self-care we take care of ourselves, and promoting that, maybe we all take a family walk, or that we, start doing things like that, so that we start creating that culture. Because as I don't remember whether it was Casey or Steven said, that, our youth are sometimes better than us at their mental health, at talking about it. And if we start modeling that, we will reduce that stigma. So it's not necessarily getting to the point of crisis, so they can share earlier, and that we share, what, even if it's something on the news has really upset me, and this is how it's made me feel, and naming those feelings and being comfortable about talking that something has affected me, and that, I just need to take a break and take a walk to to just sort of clear my head, just so that we're modeling those behaviors for our youth.
Just to quickly add on to what Ms. Walker was saying, good evening, everybody. My name is Marvin Horn. I'm the social worker for Bout Hills and Loudonville School. Each academic building has our own mental health teams, and these are critical organizations that meet weekly or biweekly, and they're comprised of the psychologists, social workers, and counselors and principals. And we do discuss our kids at length that we do have concerns about. Teachers bring their concerns about students to these meetings, so we can formulate an approach to appropriately and effectively help all of our students. So we are consistently and constantly working to serve our youth. And we do have a lot of supports that are already embedded in our school system. So please reach out for any and all matters of concern.
It's also important to
Carla.
mention. Oh, sorry.
No, go ahead, Carla. Thank you.
Just to piggyback off of you, Marvin, I'm Carla. I'm the social worker for Fort Ferry and Latham Ridge. The 6 of us also meet pretty often together and collaborate as well. So that's kind of important to know. We each kind of have our own little areas of expertise sometimes that we share with each other. We go to trainings. We're really also a good resource for each other. So that's important to know too.
That's a really good point. And when we have challenges that we face K-12 and district wide, even though earlier in my introduction, I know I mentioned that Carla was associated with Forts Ferry and Latham Ridge. That does not mean that if there is a need at our high school in another district or in one of our district of location schools that we don't utilize our resources to best support our students and families from a K-12 perspective. So that's a really important point. Thanks, Carla. I really appreciate that. And Stacy, Angel, anything to add?
I think the hardest step, and I think everybody's really talked about it tonight, and I just keep kind of sitting here thinking, how do we make this easier for our families? I'm Stacy Angel. I'm from the middle school, junior high. And I just, it is to ask for help, even if you just want to run an idea by us, or you want to share a story, whether it's about your child or about your child's friend. Just if you get that uncomfortable feeling, trust your gut and just run it by us. This is what we do all the time. And we're more than happy to, we have multiple ways that we can deal with kids and, you know, remain confidential, but we also, we do have a lot of resources at our fingertips. And, you know, if you've exhausted a few of them, we'll help you find more. And I guess the biggest thing that we want to leave you with tonight is that you're not alone. There's a whole team of people here, and we recognize the struggles that each family is going through, and you know, we can do this together. And so if you have anything, just reach out to us, shoot us an email, give us a phone call, but just please talk to us, because you don't have to go this alone.
Thank you, Stacy. That's a really, really good point. We are going to, at the end of this presentation, post all of the contact information up for families to see. I think that's going to be really important. We'll make sure that we try to post that in several different places on our website and so on, so everyone can see those contacts. So that really concludes the questions, answering the questions from our families. I guess at this point, I would open it up to the PAC to ask any questions that you might have.
Hi, I have just a couple of things. I thought this was a great presentation. It's so important, very important topic. And, you know, I always appreciate the opportunity to listen to ways to help in the process and just to be aware in my own circle with my own people. I thought it was important that, I think it was Stephen Halleck that had clarified regarding, I guess, a bottleneck rather, with the counselors and the doctors. Not just, you know, certainly not just our district, but just, it sounds like the I don't want to say the industry, whatever you want to call it, and that Stephen clarified that to just talk to somebody. Because I suspect, and maybe Sandra can clarify, and this is just one of a couple of points that I have, but that children probably or could be keeping it inside because maybe they get the sense there isn't someone to talk to as much as you all communicate that you're there and available for the students. And so I imagine that is a concern. So I suppose that's the communication and just trying to get that message out there to just talk to someone and allow those people to help you.
Right, absolutely. I think that you know, it's both at home and at school. I think that that goes back to changing the culture, that we talk more about our mental health. And I just want to state, you know, for being a North Colony parent, but also now having this role for the last year and a half, especially during the pandemic, one of the things that people may not realize that what a gift it is that we have mental health professionals in every building, much less for the district. There are many districts in my 15 county area that don't have a single mental health professional for their school district. So the fact that, yes, we do realize that there is a mental health care shortage, and we don't necessarily have enough providers or providers that may take your particular insurance, being able to have somebody in your school district who sees your kids, who can be a place to go while you're trying to figure out the rest of the plan is really something that's very important. And as I said before, creating a culture where we talk about, well before a time of crisis, talking about our mental health, focusing on things like mental health, self-care. How do we de-stress? How do we live our lives? What is the language of talking about our feelings? And I know that the district is working on that and adding, you know, resources for that. And I think that while it may not happen as fast as everybody is looking for, it will be a shift where from our teachers to our parents to the students, it will improve all of our lives if this change comes in talking more about mental health in general.
Okay, that's good. I just had a couple other super quick items. One thing is medication. I feel like this is an awareness item too, that just in my own circle of people and experience on the side effects of medication, whether it's a child or an adult, and what that could impact on their mental wellness. And also the self-medicating of removal of certain medications that is not under the direction of a doctor is also can be very detrimental to mental health and the potential for of suicide. And I think that's another very big awareness item for people to be on the lookout for. The other thing that I just wanted to mention is the pandemic, and hand up definitely for me. I felt strong through the whole thing. Suddenly I'm realizing it's over and I'm not doing as good as I was doing last year. And I had learned last night, I see a lot of heads going like this. I had learned last night, I was watching a different Zoom on mental wellness, that the suppression of feelings and trying to put that down to just push through, and suddenly you get past a certain piece of, big milestone, and all of a sudden all of these other emotions come out and you start feeling more burnout and just lack of focus. And so I don't know if somebody wants to speak to that. I thought that was really important to realize and to kind of put a name to it to help people that related to the pandemic.
Absolutely, and I'll speak first, and then I'd love to hear what other people have to say. Is that our chief medical officer Christine Moutier has talked about that too. Is that that's why I wanted to talk in the beginning about the fact that while we've seen the suicide rate decrease, that means we should be working harder on mental health support, not lightening up, because there is this sort of piece of the fact that we have been community holding things together, but as things start to open up, there's not only going to be people who've sort of held it together are going to be exhausted from that, but also there may be other stressors. I mean, they announced today on the CDC that fully vaccinated people can pretty much, can mask less, but for some people that's going to bring about anxiety after a whole year of doing it. So it's really about continuing that discussion and really doubling down on supportive mental health, because trauma and the effects of trauma, and this has been trauma for all of us in the last year and a half. Trauma is often delayed. And I'm not a medical professional either, but that is definitely what research has shown. And so that's why I say to people when they ask, well, what does it mean that our suicide rate is decreased? I said, it's great, but we want to see it continue. And the only way that's going to happen is to continue to have these discussions and continue to work on creating this culture that will make for open communication lines about mental health.
That was all that I had. I didn't know. I also just really prefer the term mental wellness versus mental health. I feel like it has such a stigma associated to it. I hope someday it changes. I know the terminology behind suicide is starting to change a little bit in how we reference it. And you had mentioned that earlier in your presentation, but I know that from my own experience with my own people that this mental health is associated with units at hospitals. And so to me, mental wellness, it just has this cheerier, kind of outlook going forward type positive energy. So thank you. I really appreciate all the information tonight.
Thank you, Karen. I just want to add to your medication, point. I think that's a really good one. And the way that we have found, to be most successful with kind of monitoring, changes in mood and so on is really, making sure everyone is aware, everyone on the student's team is aware. So teachers, principals, the more people that are informed that there's going to be a medication change, if we're aware of that, then the more eyes we have, on the student to really monitor and give feedback to the practitioner to, maybe there's a recommendation of change in medication and so on. So just one more point that I'll add, the more people that know and are monitoring, then the better, and the better we can respond to any of those changes.
If I could just go back to your first point, Karen, about the bottleneck, which is the right term that you used for lack of providers. And I apologize for my lighting issues. I think I picked the wrong room. It's getting dark at my house. But Karen, I think Sarah really focused on this too. Sarah was trying to make the point that use us. Like we're here to help with that process. We're not just going to hand you a list of names and phone numbers. And we want the community to really, embrace the fact that we are here to help with that process every step of the way. We're not, just gonna send you on your way with like a referral list like a dentist might. So we're here to help.
Thank you.
And Karen, if I can just follow up on your comments about the pandemic, I think in addition to trauma, I think what we've experienced is a collective grief. Everybody has lost something over the last 15 months. Unfortunately, for many people, too many people, it's a loved one because of the pandemic, and for other people, it was their job or other things about their life that gave them like routine, or maybe it was a loss of religious observance because they couldn't go to the place that they sought refuge on a weekly basis, or kids lost all sorts of things in terms of like milestones and life cycle events. So there has been a lot of loss, and I think we have to sort of come to grips with that and treat it that way. And the first way to do that is to name it. And I think it's great to be able to talk about it in those terms, because we know we can lose things, but then we can recover from them also.
Good points. Yeah. Thank you.
Thank you.
And I'm just going to jump into, I guess I'm having lighting issues as well, Steve. Well, the thing I just wanted to mention too is when we talk about this and the transition, I have a lot of kids, at the junior high level who are already thinking about September, whether they're remote, especially our remote kids right now who will be transitioning back into the building. So that is a big fear and a huge anxiety producer for some of our kids, and being around other kids going, and so we are recognizing that and acknowledging that with our kids. And it's real, it's a real thing that they're experiencing. So we are going to be looking at kind of gentle ways to transition them back and prepare them, because as tough as the pandemic was to start, we have to also acknowledge that it's going to be kind of tough to end as well for some of our kids.
Just to reiterate one more time, we do have, and I feel like I need to change this term now. We do have mental wellness organizations in each building at the elementary level, the middle school level, and the high school level, where we meet very frequently. So please bring your concerns to somebody, and they will get to our teams, and we will discuss them, and we will help our students.
Thank you. And thanks. Yes, Stacy.
I just wanted to mention too, at the high school level, if you go on the high school website and you go to the counseling center, there's the mental health team website, and that has pictures. We put all of our pictures with our school psychs and our mental health team, so kids would have a face and know who they're contacting with their email so they can reach out. Sometimes students like to do that because they are struggling during this time, honestly, to communicate in person. So they feel a little more comfortable that way. We have a whole student resource section with all different ways to help with their mental wellness. Positive things about, how to help if they're struggling with sleep, which a lot of them are, and schedules, and, meditation and mindfulness, and just different options. In addition, there's a parent resource page. There's a community page that has a lot of links to different resources in our community to help as well. Not everybody's comfortable reaching out and talking to people yet, and we acknowledge that. We just want them to get resources anyway. So that is on there. And we actually, May is Mental Health Awareness Month. So we have a whole page on a lot of mental health awareness pieces, how to help, listen to friends, and just people's stories to try to break the stigma. So at the high school level, and we even have a teacher page that has resources for teacher wellness as well. So we're trying to update that and continue to add things to that, just again, to meet people where they're at, which is another big thing I think we often forget. Maybe for some people, they're out and they're communicating in the community. We have a lot of students who aren't comfortable with that yet, and families who aren't comfortable with that yet. So I think that's also a struggle, because everybody's at a different pace with the pandemic and where their comfort level is. And that's a struggle for kids too, when they're seeing some of their friends are able to hang out, others are not. And so just trying to find different ways to acknowledge where people are at and meet them in any way is important. And we're always open to more ideas. So again, it takes a village, and we try to be the experts best we can in our area, but we're always looking for more feedback from the community to help us. If there's things we don't have or we're not doing or you'd like to see more of, I think what helps us grow as a team is hearing from the different community members as part of it.
And I think the last point that I want to highlight here is, that we are committed as a district to mental wellness. So thank you, Karen. I'm going to switch that language starting today. We're committed, and I think, our mission highlights that, and our pillars highlight that, in the fact that we are, supporting, in this year's budget, a director of social emotional learning with an equity lens. I think that is also, very high. It highlights our commitment to this work, and we will continue to move this work forward, and we're excited about that. That's all. Back over to Mr. Core.
Well, thank you very much, Casey, and I want to thank you. Sandra, thank you very much in your position as area director for the American Foundation for Suicide Prevention, and also as a district parent. We thank you so much for your willingness to reach out, to come forward, and to help us organize this evening to reach out to our community. It goes also, so
that we share the screen with all of the social worker contact information. So can I do that now?
sure. And just before we do that, I would like to thank our mental wellness team for their wonderful work. So again, thank you, Carla. Thank you, Stacy Angel. Thank you, Sarah. Thank you, Stacy Walker. Stephen, Marvin, thank you. Thank you for first all the work that you do with our students and our staff on a daily basis, for your organization of this evening, and just for being there and being present for all our students, our families, and for us. Your work is so important and so needed more than ever. So we are so filled with gratitude to each and every one of you. So thank you. And so there is our team, and that's their contact information. This presentation will be recorded and posted on our website. You can take a picture of this with your phone, but this is the contact information for our mental wellness team that you saw on tonight's presentation, and they are all here. So thank you very much. So again, this concludes our PAC meeting for this evening. Thank you to all the members of the PAC and to our audience on the live stream for participating and giving of your time to learn and become aware of strategies, and also our local district resources that are available there to support you each and every day. Thank you so much. Have a great evening, and take care, everyone.